Welcome, welcome, welcome. I'm Dr. Arnold Nierenberg. I've been licensed to practice clinical psychology in the state of California since 1974. And I've came upon this earth in 1941. It's my good fortune and privilege to meet so many wonderful, wonderful people, particularly in my practice as a psychologist, just the loveliest people that I've ever met. I've been through my practice, actually. And it's my intention to help uplift you and your loved ones for the rest of your lives. That's really what the intention is of giving these seminars. And the side effect of that is I hope to uplift myself. I get a lot of inspiration. I get a lot of making these presentations. That's why I'm so grateful to be in your presence. The opportunity to serve you, to bring you this knowledge, this inspiration, gives more meaning to my life, helps fulfill my destiny and my calling, and uplifts myself. So I'm grateful to be here with you. The title of today's presentation is An Amazing New Medicine to Enhance Prognosis for Cancer, Cardiovascular Disease, Anxiety, and All Diseases and Disorders. It's a pretty tall order. An amazing new medicine to enhance prognosis for cancer, cardiovascular disease, anxiety, and all diseases and disorders. And it's natural. So we have an amazing medical profession with allopathic medicine, alternative medicine, natural medicine. We have such dedicated doctors and nurses and nurse practitioners dedicating their lives to doing so much good and saving lives and giving people hope. Amazing what we have or what can be done. And then the research that's going on in terms of allopathic medicine and the research that's going on in alternative medicine, natural ways of reducing inflammation and preventing cancers. And they work together. Sometimes you just see an allopathic approach, sometimes allopathic, but very often combining the allopathic and alternative medicine. Great combination, a great combination. So we all know that foods, natural supplements, allopathic medication is our medicines. We also know that exercise is now being considered a medicine. It's like a magic bullet. It helps improve the prognosis for any disorder. You're getting the circulation going, getting the lymph moving, tremendously enhancing. So I've introduced the concept from years ago as thoughts as medicine. Thoughts as medicine. And so today I'm just updating that and presenting it in a different kind of way today. It's a fact well established in a lot of the literature, the medical literature, that optimism will enhance prognosis. Optimism will enhance prognosis. Well-established medical fact in terms of the research literature. So I've developed the area of, through the honor movement, one of the goals of the honor movement is to bring thoughts into the field of medicine and actually have thoughts to be considered medicine. And I'm particularly today going to be aimed at the thought that will enhance optimism. So we know that optimism enhances prognosis. But nothing's been done to enhance optimism. It's just a fact. They say, yeah, if you're more optimistic, you have a better chance of surviving whatever this is and to recover more quickly. Fact. But nothing's been done to enhance it in a systematic way. And it's my intention as bringing through the honor movement to bring some of the thoughts that we have in the movement to medicine. So that's what we're talking about. What can a doctor do? What can a nurse do? What can a nurse practitioner do that will increase optimism? What thought needs to be prescribed that will enhance optimism, increase optimism, which then in turn enhances the prognosis for cancer, cardiovascular disease, anxiety, all diseases and disorders. What is the thought that can do that? So I call it a derivative of one of the four commandments of honor. One of the commandments of honor is, I'm grateful for the power I gain from hardship. Well, one of the derivatives from that is, I intend to come back much stronger than ever. I intend to come back much stronger than ever. I intend to come back much stronger than ever. There's no downside, no bad side effects, none. And it takes 3 or 4 seconds, 5 seconds to administer. And you don't have to worry about it interacting badly with any medical procedure or medication, anything. There's no negative consequence to it, none whatsoever. At worst, it'll have no effect. At best, it'll enhance, it'll increase the optimism, which we know for a fact enhances prognosis for all diseases and disorders. So here's how it would go. Let's say doctor meets with the patient and says, we did your biopsy, it turns out you have cancer. They may go on to say, well, it's a fairly aggressive one, there's an intermediate amount. And that's kind of how it's delivered, actually. That's how it's delivered. Sometimes I might even say you have a 50% chance of survival. I may even give you a percentage of survival. But there's nothing in there that enhances optimism. So it's a very simple procedure what they're talking about from the medical professional giving a diagnosis, or the nurse practitioner, whoever it is. So then it goes this way. And this can be used across the board. So now I want you to tell yourself, so here's the prognosis, you had cancer. And I want you to tell yourself that I will come back much stronger than ever. Let me hear you say it. When the patient repeats, I tend to come back much stronger than ever. Good. And let me tell you something. I intend to do all I can to help you come back much stronger than ever. Nobody's doing that. I mean, nobody. And we're talking 10 seconds. 10 seconds, 15 seconds. The most, you stretch it out 30 seconds, 45 seconds. At the most. And what harm could it possibly cause? Tell yourself these words. I intend to go out much stronger than ever. Or you can even have it printed out and give it the card. Here's the card to remind you. Say it all day long. Use it at least 3 times a day. Now, if they're in a hospital setting and there's a surgery coming up, the more often the better. What harm is there? Listen, all the medical professionals are very busy people. Extremely busy. We're looking at 15, 20 seconds, minute tops to potentially enhance the prognosis by increasing optimism. Tell yourself these words. I intend to come back much stronger than ever. And then the other step is, and I'm going to do all of my power to make sure you're going to come back much stronger than ever. Now you're saying, I'm behind you. Here's the thought, and I'm here with you. It's very simple. Totally natural. No side effects. You're not going to have a digestive side effect. It's not going to interact with some other medication. It's not going to in any way retard or interfere with whatever surgery you're going to do. Nada. Nothing. I would go, now that this knowledge is out there, it's so important. I'm going to say something very strong. I think it would be medical malpractice not to do this. If we can give that to a patient and potentially enhance their prognosis and not do it with a 30-second, 45-second procedure of telling people that, to me, that's negligence. Once the knowledge is there, right now that knowledge is not in the medical profession, so I'm not accusing anybody of that at this time. I say it needs to be circulated, it needs to be brought into the medical settings by our great nurses, our great nurse practitioners, our doctors. This is a wonderful thing. And even the mental health profession, same thing. I tell my patients, one of the goals, the main goal when you're coming in, is for you to come back much stronger than ever. And I'm totally committed to helping you do that. I'm already doing it. It creates an optimism. It creates a positive outlook, which will in no way cause damage. None. By having that intention. None. Okay, so there's more I could be adding to that, but I don't want to dilute it. I don't want to dilute it. There are other thoughts that we can be used. I've talked about in other lectures. But what I did that was different today. In the past, I had the thought that the patient could be reciting, but today I introduced a new element, what the medical professional can say, to prescribe it, and to say that I'll do all I can to help make that come true. And then certainly then it can be reinforced by the other medical professionals. Let's say a patient's in a hospital, the doctor's already prescribed this thought, the nurses, when they come in, are you repeating your thought that you intend to come back much stronger than ever? Good. How often are you doing it? Good. What effect is that having on you? At least if they have time, they could reinforce it. You can even give literature out to the family saying, you want to reinforce this effect. This is what the goal is here for your son, your daughter, your mother, your father, whoever it is, to come back much stronger than ever. This is our intention. And this is what he or she is repeating to himself or herself. So the family's coming around, and then you tell the family whatever you can do to help enhance this, to increase this in your relative or your friend, whoever it is. This will help increase the positive prognosis. It's a wonderful thing. Wonderful. Now, we have the good fortune today of having Bertrand. We have some wonderful people here with us who are on the Zoom call. Bertrand's a nurse practitioner. Bertrand, what is your honest thought or feeling about this new natural medicine?
Hey everyone, I love it. I think a lot of times we focus on the physiologic part of things and not so much on mental and emotional, which is all part of recovery. And as you stated, just the installation of hope. I see you getting better. I know that you'll get better. Can dramatically improve someone's prognosis because mentally just restating that to yourself, just reinforcing that really does help you more than just physiologically, which, the medicine and all of that is going to take care of itself. But you have to mentally put yourself in that state of mind. So I love it.
I intend to come back much stronger than ever. And how do you feel about the doctor prescribing it and saying, I intend to do all I can to help make sure that happens?
I think that should have already been happening, but it doesn't. And for many reasons, you're short of time. You don't think it's as important, but it really is. And just that little bit to the patient, it's enough to really start and kickstart their recovery, because mentally they're putting themselves in a frame of mind of healing, and they can see themselves at the end, the outcome already. It looks better. So I think we should be stating this.
Well, and there's a ton of research showing that optimism enhances prognosis. I mean, that's well established in the medical literature. All I've done here is say, here's a mechanism, a way to do that, a thought that can stimulate that process. And there's no downside to it.
Right.
I mean, that's the beauty. Any medication, any surgery you have, there's always a potential downside, maybe even lethal. Isn't that right?
Oh, definitely. I mean, this takes, like you said, 30 seconds. It's a quick blur. You may not put as much value to it, but the patient definitely will. And ultimately, we hope that even the clinician really does believe that it really does start appear cognitively. And so that takes no time at all to say, and the patient leaves feeling like this is not impending doom, and this is the end of the road for me. And they can look at anything such as even cancer with a positive lens.
Certain percentage of the doctors will really be able to get into it. A certain percentage of nurse practitioners and nurses can really get into it, and it's an intention. We're not saying you will come back much stronger than ever. You're saying that's your intention, is to come back much stronger than ever. That's the intention from this whole thing. And I'm going to do all I can to help you manifest that intention. So there's no illusion, no lie, no false promise in it. This is the intention. It's a wonderful, wonderful thing with no negative side effects, which every surgical procedure can potentially have, every medication can potentially have. But when it comes to thoughts as medicine, there is no negative side effect. Even exercise as medicine can damage somebody. They can trip or fall or overdo it and tear a tendon or whatever. But there's no negative side effect from thoughts as medicine. It's pure. It can only help, and at the worst case scenario, it has no effect. That's the worst case scenario. Yeah. Very good. Very good. Thanks, Bertram. Thank you for your professional input on that. Appreciate it.
No problem.
Yeah. Jay, what are your thoughts?
This is very near and dear to my heart, because I had knee replacement surgery about 8 months ago. And when I was talking with the surgeon afterwards, I said, realistically, what is this prognosis? How quickly will I heal from this? He said, more than half of the healing process is going to be your positive thinking. He says, if you think you're going to get up and be running and jumping, at a certain amount of time, that's what's going to happen. He said, if you just sit and lay around, he said, you're not going to heal near as quickly, or possibly not near as well as you would if you think.
But you see, he didn't have the tool yet to then tell yourself, I intend to come back much stronger than ever. He didn't have that tool yet. He knew the phenomenon, but he didn't have a tool to give you.
But he verified what you're saying.
Oh, right.
Positive thinking.
Yeah, absolutely.
It could be a healer. It seriously can. I feel fantastic right now. At 65 years old, feel better than I have in 2 decades.
Wow, Jay, I know.
Because of my the way I feel mentally right now, and because I choose to come back stronger.
Beautiful, Jay. Yeah.
So,
your attitude.
Very, very true words. Very, very near and dear.
Well, it's good to hear that from you, Jay. And then with your practical experience on the patient side, very, I had prostate cancer when I was 65 years old. And the doctor said, well, it's somewhat aggressive. It's a Gleason of 7. It's an intermediate amount. He didn't give me any of those things. I was the one that said to him, I said, that's great. My face went numb, and then I said, Doc, that's great. He says, what do you mean? I said, well, I intend to, this prostate cancer will make me stronger mentally, emotionally, and physically. I didn't have the thought yet. I intend to come back much stronger than ever. He was pretty shocked, and I did feel amazingly elevated. I walked outside and saw the trees and the birds and sky like I'd never seen it before. I felt so much love for everybody. But he didn't. He told me it was an intermediate amount, decent of 7. That there was no encouragement. He never said that we have some good options. I think he said we have some treatment options. But and you see, we have. I mean, if you think they're good options, if you sincerely believe they're good options, you could say we have some good treatment options. The word "good," or we have some excellent treatment options. Oh, those are very uplifting. But to go, well, we just have treatment options. Well, maybe that's good having options, but it really helps that we have some good treatment options. We have some excellent treatment options, if that can be said with honesty, which very often would be able to be said honestly. Tracy, what are your thoughts?
I think it's a great idea for doctors to really be able to implement this, medical doctors to really implement this, and other people in the medical field, because this is accessible anytime, anywhere. Even if you were to learn these laws or commandments or these thoughts to say, even if you were kind of to end up in a vegetative state, you can still think these things, because you don't know what really goes on in certain people's heads if they were in that state. But some people eventually come out of something slowly.
Like some people come out of comas all the time.
Right. And to have these taught to us by medical professionals, or even, in school and anywhere, you can really grow with it. For example, I'll be fine. I'm grateful. I'm extremely grateful. Thank you.
That was another one that's part of the healing process. I just focused on the one, but good point. That's one of the good ones.
And I'll be fine. I'm grateful. Thank you, God. Or I'll be fine. I'm grateful. And it will happen on its own time, not mine. Or it will happen in God's time, not mine. And people just kind of helping uplift themselves with these laws and these commandments.
Very well said, Tracy. Very well said. And very, very true. In fact, on my past presentations, I mentioned those thoughts, but today I just wanted to get one thought across. One very healing thought, one amazing natural medicine. And then once that gets into the medical profession, we can introduce some of the other thoughts. But that's totally right on. Stacy, what are you, excuse me, Tracy, I'm sorry, you can say something? Please.
Just one last one. One is, I arise to the struggle always.
Yeah, that's right. I arise to the struggle always. Yeah, so we don't give up. I'm going to rise and I'm going to handle this thing. Absolutely. Very powerful medicine. Powerful medicine. The mind-body connection is well established. That's nothing new anymore. Everybody believes in the mind-body connection. Everybody. Everybody believes in psychosomatic illnesses where the mind can make a person sick, and we know that stress kills. This is well known, and so this is then just taking it in another direction, in a positive direction, of adding a life-giving thought instead of a death thought, a stressful thoughts like that. Death just gives life, a life-giving thought. Totally right on. Stacy, thanks, Tracy. Stacy, what are your thoughts?
Yeah, I love thoughts as medicine. I think that, like Tracy was saying, just having it as something that you can wake up to and think about on your own. That's not a prescription or a pill or something that you have to consume to think that you feel better, but something that's already inside of you that you can treat yourself with in a way, is so powerful. And I'm big on, what we think we manifest. And so sometimes we can even manifest our illness if we believe it enough, and if we are, engulfed enough in our own sickness, and bringing it to the professionals would be great to hear that, as an actual form of medicine. So not only are they, working on the knee, or they're working on the back, or they're treating the cancer, they're also giving tools outside of a treatment or something that's concrete that they can, because you can't see it, touch it, taste it, or feel it. You can only think it. But wow, what a powerful drug.
It's a very powerful drug, and it's self-healing, self-treatment, but it's a prescribed self-treatment. Here's how you can help yourself. And also hearing from the doctor that he intends to do all he can to help manifest you coming back stronger than ever. So it's really a double statement here. One is what you're saying to yourself. That's very powerful. You can use it all the time. Even if you're in a coma, you could probably still think it, even if you can't speak. Potentially that's true. But then hearing from your doctor that he intends to do all he can to make this manifest, that you come back much stronger than ever. That's the second part to it. In other words, here's what you're going to do for yourself. Here's what you do for yourself. You're going to tell yourself, I intend to come back much stronger than ever. That's one. But what I'm going to do is not only tell you your treatment options, but in addition, I, as your physician, as your medical professional, I intend to do all I can to help you manifest coming back stronger than ever. That's double. So you have your self-healing, and then you're getting this energy from the doctor that he's going to do all he can. I've never heard that. I mean, I'm 81 years old. I've had heart attack when I was 61. I had prostate cancer. I've had for different surgeries, different things happening different times. I mean, I've never heard anything like that at all. I've been around it. None of my anybody I've known who's dealt with doctors or nurses or nurse practitioners, none of them ever told me they've even heard anything like that. It's so simple. It's so obvious. Sometimes the obvious is just the hardest thing to see. Yeah. Lydia, what are your thoughts? Thank you, Stacy.
This reminds me of mental detoxification, and I like how you say that, to fill oneself up with life-giving thoughts, and at the same time recognizing the thoughts that we constantly repeat that are toxic, and then just choosing to stop.
To balance it with life-giving thoughts. Exactly.
Yeah. Choosing to stop worrying, choosing to stop being anxious, and just knowing that there's always a way, even if it's not entirely clear. And in a sense, that's where the faith comes to, God, I'm grateful for the trials and tribulations that bring me closer to you, and I'm going to do everything in my power to get through this, and knowing that you're leading the way.
Well, these are all incredible things you've just said. These are some of the incredible thoughts that we're going to introduce later. Once we get the concept of thoughts as medicine, absolutely this is going to have to be brought in, those thoughts you were mentioning. And the idea of mental detoxification, because what we're doing is introducing a very life-giving, healing thought in the midst of very toxic, pessimistic, worrisome thoughts. Oh my God, is this the end? Am I going to be able to, lead a normal life? Will I be able to be with my kids, my grandkids, whatever? Having all these worries and thoughts. So you have these very toxic inner environment going on, and now you have this happening. I intend to come back. Wait a minute, I intend to come back much stronger than ever. So it's really, as well said, I've written about it, and I've lectured about it, as Lydia just said, mental detoxification. It does lead to that as part of a detoxifying process. Now, thank you very much, Lydia. Well said as always, always insightful. So, along these lines, from the honor movement, we're creating the International Association of Thoughts as Medicine. The International Association of Thoughts as Medicine. Bertrand, what do you think of such an association for the medical professional, International Association of Thoughts as Medicine? You as a nurse practitioner, what are your thoughts?
I do think thoughts are medicine. I really believe in the power of positive affirmation. I think whatever you speak into existence is what you potentially put out there for yourself, and it is healing. What you feed yourself, the thoughts that you think do lead to healing, and so I think the two are definitely congruent, and we should be kind of using that with our patients and the people that we see, even if we think that it is not as good as the actual physiological side of things. We definitely should be focusing on the patient as a whole, and that does include their thoughts and mental. So,
yeah, a physician might rightfully feel it's not as robust a variable as the medication, the allopathic medication or the surgical intervention, but there can be recognition based on research of enhancing optimism, which enhances prognosis. But actually having an International Association of Thoughts as Medicine and having a lot of empirical studies there are studies, I'm sure now, because we know optimism enhances. So right there's a lot of studies on that. There's a lot of studies on gratitude as facilitating positive health. So what are your thoughts about having an International Association of Thoughts as Medicine, having such an association?
I think that's absolutely necessary. I think, again, thoughts are medicine, and your patient really listens to the things that you say, and if you're hopeful, if you have a positive outlook, if you're optimistic, then they feel that there is hope, and so just that little tool, the little blurb, is quick, it's easy to remember, and it's something that definitely translates to better outcomes, especially if the patient is saying it enough times to where they're believing that.
Thank you, Bertrand, for very excellent feedback. Thank you so much, especially from you as a nurse practitioner. It's almost comical. Imagine somebody say, well, are you diagnosed with cancer? And, you have about 3 months left to live, so get your affairs in order. I mean, people have heard those things and defeated it, but hearing, that you're going to be dead in 3 months. I mean, it might be that's what the statistical information would lead to. You'll probably be dead in 3 months. The other thing to add to it, statistically speaking, you probably, your life expectancy to be about another 3 months, 4 months, a year, whatever. But you know what? There's always breakthroughs. Your attitude makes a difference, and there are people that beat these odds, and you could be one of them. What's the harm in that? And we're talking, and everybody's in a rush, but we're talking 30 seconds, 45 seconds to administer this. So just leaving a person, you're gonna be dead 3 months. I mean, a person, that's like voodoo. And they think, yeah, so 3 months is up, boom. It's like, we could definitely expand that. The person might, in fact, end up dead in 3 months, no matter what thought you give them, but there's a possibility, but those odds are beaten. I know one guy, He was given, I think, 6 months to live. He had pancreatic cancer. 10 years later, he was alive. He went to change his diet, his way of life. And I don't know how he's doing now, but 10 years later, he was still living a very active life. And you hear those stories all the time. And you're looking at a patient, you say, you could be one of those stories. Well, it's been my pleasure to present to you and to be in your presence an amazing new medicine to enhance prognosis for cancer, cardiovascular disease, anxiety, and all diseases and disorders. It's a pretty grandiose title, but I think I made good on it.